Now, America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. All right, joining me in studio once again, Tony Pointer from Blue Cross and Blue Shield of Kansas City. Welcome, Tony.
Thank you, Carrie.
And we have a new member of the team today, Sherry Blankenship, joining us in the studio. Not new to Blue Cross, but new to the radio, right, Sherry?
That is correct.
And we're
Thank
happy
you.
to have them in studio today. So our topic today is Medicare. And look, we're going to talk about a lot of things today. So if you're concerned about this, or you're getting ready to retire, or you're approaching retirement age, or maybe your wife's going to hit Medicare and you're not, or vice versa, there's a chance here to listen and learn. Yes, we're going to talk about Blue Cross and Blue Shield's products, but we're also going to talk about the nuts and bolts and the alphabet soup of Medicare, meaning Part A, Part B, Part C, Part D. We're going to talk about all that stuff today. So this is a chance to listen and learn about Medicare and how it all works. So let's just start off with this, Sherry. If you're 62 years of age, can you get Medicare at 62?
Well, that really depends, Carrie. So typically you get Medicare when you turn 65, but there are windows of eligibility, such as if you've been on Social Security disability for 24 months or certain chronic conditions like end-stage renal disease, they could allow you early eligibility access.
Okay, but the typical then is 65. That's typically when most of us that are chronologically challenged, see, you people are all very young in this room, Shaylee, Tony, all of you. But for those of us that are seasoned citizens, it's typically when you turn 65, right?
That is correct.
Okay, so that's and people, they start thinking about this. They need to start thinking about it before they get to 65, right?
That is correct.
Yeah.
So your initial eligibility window is going to start 3 months prior to your 65th birthday. And that's a great time to really do a deep dive into the product designs so you can figure out what works for you and what you're looking for.
And we're going to talk about that because and what those different products are. Tony, let's talk about what Part A is, because we talk about the alphabet soup, so we're going to start going through some of it. So just describe Part A, and then we'll get into Part B.
So Part A is the hospital part, Carrie. Part A covers inpatient care provided in hospitals, skilled nursing facilities, home health care, hospice for the terminally ill, and typically Part A is premium free.
Yeah, and that's really – and you get automatically enrolled in that. You don't have a choice in
Correct.
that. So William Jefferson Clinton saw to it that became permanent when he was president of the United States, so you're automatically enrolled in Part A. Sherry, let's talk about Part B. That is a different deal, and you have to sign up for that, right?
Typically, unless you're pulling Social Security, then at that point they'll automatically enroll you in the Part B, but you would do an outreach to Social Security to acquire that.
Yeah, and you have to go online and do it. And as I always tell you folks, I did it myself. Believe me, if I can do it, a chimpanzee can do it. It took me about 20 minutes. So you can actually go up on the website for Social Security, Medicare, and it like I said, it takes about 20 minutes. And if you're having trouble with it, then you go to the Social Security office and sit down and talk to them. They'll be happy to help you, right?
That's correct. They'll also schedule phone consultations as well.
Yeah, and that makes it a little bit easier. So, Tony, let's talk about – this is something people get confused about. They're coming off of an employer-sponsored plan, and, okay, so what is my deductible and my coinsurance going to be on Medicare?
So your Part A deductible is going to be $1,556. So $1,556, and your Part B premium is going to be the $170.10.
Yeah.
So
but it's not set up like an employer-sponsored plan with a deductible and a coinsurance and an out-of-pocket, and the list goes on. Yeah. Medicare, a lot of people, Sherry, say that when they go to Medicare, oh, I just got a salary increase because the cost of the health care went down versus what they were paying for employer-sponsored healthcare. So there are some differences, right?
There are some differences. The big thing with straight Medicare is there's not an out-of-pocket maximum that we're used to underneath our employer plan. So that's something to consider.
Yeah, so when you say there's not an out-of-pocket maximum, that means that you're responsible under Medicare. If you don't have a supplement, we're going to talk about those, or a Medicare Advantage plan, you're responsible for 20% of whatever that bill is when all is said and done, right, Tony?
Yes, and that can go on forever. There is no stopgap.
So let me illustrate that for you. So if you have 100, when Lori broke her leg and we were in Hawaii and the bill was about $147,000, if we had not had the Blue Cross and Blue Shield Medicare supplement plan, we'd have been on the hook for about $30,000. Okay, because that would have been our 20% of that total medical expense. By having a Medicare supplement, we didn't have to pay any of that. But the point is, because you hear this from time to time, well, all you need is Medicare Part A and B, except they forget about that, don't they, Sherry, that there's that 20% hanging out there?
That is correct.
Yeah, and that makes it a little more, there's a little more to be concerned about there, right, Tony?
Yeah, there definitely is. And to your point, if you had one large situation where it's $100,000, you're picking up 20, there's nothing to say that situation couldn't happen again a month or two further down the road.
And you're going to do it all over again.
You're going to do it all over again.
Yeah, there's no cap on it when you're just doing straight Medicare, right, Sherry?
That is correct.
Yeah, and that's what I think sometimes people have a tendency to overlook that and go, oh, I got Medicare Part A and B. And then something happens and you get home and you get that lovely letter in the mail that you get to pay the difference of that, and it's your responsibility.
Yes, that is right.
Yeah, and I think sometimes people have trouble kind of putting those things together. Let's talk a little bit about Medicare subs. And before we go to break here, we got about 2 minutes, and then we'll come back and we'll kind of dive into the rest of MedSup and Medicare Advantage. So we have a Medicare supplement plan, Tony. Mm-hmm. We've had it with Blue Cross and Blue Shield since we turned 65. They're very different than Medicare Advantage plans. So talk a little bit about what makes them different.
So on a Medicare supplement, you're going to pay a monthly premium. The beauty of a Medicare supplement, as long as the doctor or hospital takes Medicare, they're going to typically take your Medicare supplement plan. On Plan G, you are going to have an initial deductible. What's the deductible now, Sherry?
$233.
$233. And once you pay the $233, everything else is picked up at 100%.
Now, and let me illustrate that. I just told you about the $147,000 bill we had when Lori went through this whole broken leg issue. We paid nothing. We didn't pay a copay. We didn't pay a deductible. We didn't pay anything. Okay, it was amazing. Okay, and that included, ambulance. That included outpatient. That included physical therapy at the house. I mean, the list went on. Okay, but because we had that Medicare supplement plan, there was no out-of-pocket of any kind, and that was kind of amazing, Tony.
Yep, Medicare supplement is a fantastic plan. A lot of people love it. On the other side of the spectrum, some people can't afford that monthly premium, so they choose a Medicare Advantage plan.
And so when we come back from the break, we're going to talk a little more about the MedSups and a couple of things to go along with them, but we will now get into the Medicare Advantage plans, and we'll talk about why they are different. And for a lot of folks, they make a lot of sense because they are very affordable, zero premium in a lot of cases, and we'll talk about that and how all of that works. If you want information from the folks at Blue Cross and Blue Shield, the website is bluekc/medicare.com, bluekc/medicare.com, or you could call Sherry. We're going to actually give out her number direct today, 816-395-2916, 816-395-2916. She will be happy to help you. Look, if you just want to talk to somebody, talk to her. She'll be happy to help you. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIU Radio Network, coast to coast across the USA. We'll be back with more.
Tell me, darling, am I right?
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. Send me an email if you've got a question. I can help you with something. I'm more than happy to do it. Our producer, Ms. Shaylee Henning. I'm your host, Kerry Hall. In studio with me, Tony Pointer and Sherry Blankenship from Blue Cross and Blue Shield of Kansas City. We're talking about all things Medicare. So you just heard a lot of information there in that first part of the show. Remember what I said. These are all up on the podcast platform. So you can go up to Spotify. You can go up to SoundCloud. You can go up to Apple Play. They're up there. So you want to tell somebody about this, or maybe you want to have your husband listen to it or your wife listen to it. That's a great way to do it, okay? Also, if you want help, the website is bluekc/medicare.com, bluekc/medicare.com, or you can call the lovely Sherry at 816-395-2916, and she will be happy to talk to you and just walk you through what might make sense for you. Once again, her phone number is 816-395-2916. Let's go back, Sherry, to the MedSups. So they're different from the Medicare Advantage plans because they don't have the Part D, right?
That is correct.
You might want to explain that to folks.
So for individuals who are going to elect Medicare A and B and pick up a Medicare supplement plan, such as Plan G, they may want to go ahead and add a prescription drug policy so they're not going to incur a penalty later on life if something was to change and they were to pick up or have the need for prescription later. So a Part D is a standalone plan. It does come with its own monthly premiums, and it could potentially have a small deductible or copays attached for the prescriptions that you need. It's very easy to acquire. And so with Medicare, sometimes they don't cover certain situations such as prescriptions or a routine eye exam or routine dental. So you may want to pick up a few extra policies to cover those gaps for
but
you.
The D is the important part. What is the benefit? And it's the same benefit regardless of whose Part D you sign up for. What's the benefit this year? Is it $5,400 this year, Tony?
For prescriptions?
For prescription drugs.
Oh, the gap.
the
Are,
gap.
are you talking about the
I
gap?
call it
Yes.
the gap now. That's
Yes.
not a store.
Yeah.
Okay, we're talking about Medicare.
The prescription coverage gap is $3,430.
See, I was off. It's $3,400. Okay, so that's
Yes.
the gap. All right, so you mentioned this penalty issue, and I used to run up against this. Well, I don't need prescription drugs. I'm not taking anything, so why would I sign up for that? Because if you don't, what happens?
You'll have a 1% penalty of the national average that's accumulative for every single month you didn't elect it.
Now, if you want to try to calculate that off the government website, have a ball, okay? But let's just say that so you understand. So you wait 5 years, you didn't do it. Now you go sign up. Because you signed up, the penalty doesn't go away, right? You get to keep paying it.
That's correct.
Yeah, forever.
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 It's for
the
life.
rest of your
Yeah.
life.
It's for life.
So the smart thing to do is to get a Part D prescription drug plan, right, in place.
That is correct.
Yeah,
Protect
because,
yourself.
Again, if you're chronologically challenged, folks, there's a good chance you're either taking prescription meds or you're going to wind up taking them at some point down the road. So it's kind of important for people to understand that. So the other thing is, we talked about Plan G. If you're on a Plan F like we are, I wouldn't change that, would you?
No. So if you're on the F, you're grandfathered in.
Correct.
So new individuals, the more equivalent policy to F would be Plan G.
But now we're on an F. We won't be moving off that anytime, period. So just so you know, if you're on an F, you heard us talk about G, the F plans are already grandfathered in, so there's no issue with those whatsoever. All right, so now let's kind of get started on the Medicare Advantage plan. So start out, Tony, and let's just talk a little bit about what is an MA plan and then how do they work.
So on a Medicare Advantage plan with Blue Cross Blue Shield, it's a zero premium plan. It's Encompass A, B, and the Part D, which Sherry just talked about. It includes zero premium. All our plans are zero premium. You can go to the doctor, the hospital, pharmacy, and also, too, ours includes additional things. We have Blue Benefit Bucks. We have over-the-counter benefit. You can get procedures, labs, tests, x-rays. What it does, Carrie, it puts it all into one big bundle for you. And again, that premium is zero.
Yeah, and it's that. So here's the question that I used to get all the time: How can that be? What's the catch?
So, and it's really simple.
Yeah.
The federal government pays private insurance carriers like Blue KC to provide coverage to people who are eligible for Medicare Advantage plans. We work hard to manage those dollars carefully and wisely.
Yeah. So basically, the federal government has stepped in, created this plan, and what are there now? I think about 12 million people on this plan across the country. Is that right, Sherry?
That is correct.
Yeah, it's about 12 million people. So it's amazing how it continues to grow and get better and better. So zero premium. We want to make sure they heard that, right, Sherry?
That is correct. Zero premium for all of our Medicare Advantage plans that we offer here in the metro area.
Yeah, and it's important for folks to understand that. So this is where we get to the Medicare Advantage discussion. The Medicare supplements, you're going to pay a premium. I can't remember what ours is, and I think it's like $180 or $190 a month. I can't remember what it is. It's certainly a lot less than it was on employer-sponsored health care. But having said that, the difference here is there is no premium on the Medicare supplement plans, right?
That's correct. So a lot of individuals like to hold on to their money and use it to pay copays on a Medicare Advantage plan as they present themselves throughout the year.
Yeah, so let's go through that, Tony, and talk about so these are different. Under the Medicare supplements, there are no copays. There's none of that.
Yeah.
That's a different deal here. Let's talk about that.
So on a Medicare supplement, you're going to pay that one-time deductible. What was that number again, Sherry?
$233.
$233. Everything else is covered at 100%. On a Medicare Advantage plan, it's zero premium, zero copay for a PCP visit, However, if you go to a specialist, depending on which plan you choose, in or out of network, it can be $25, $50 out of network. If you go to the hospital, where you have discovered zero copay, with us it's $325 per stay.
Yeah, so there are copays on all of these things, right, Sherry?
Not all of the things.
Okay.
There are going to be
See, I was wrong.
there are going to be some items that are going to have the zero copay, as Tony mentioned. The primary care physician, if you stay in network, diagnostic tests, procedures, labs, they carry a $0 copay. So you can get your preventative done as well at no additional charge when you go to the physician.
Okay, so all of this is important to clarify that, and I'm glad you did. All of the preventative that you may need to get done, whether it's a PSA cancer screen for men, or whether it is a colonoscopy, or whether it is an EKG, or whatever the case may be, if that's part of preventative medicine, you're going to get that without paying anything. There's no out-of-pocket, there's no deductible, there's no co-insurance, there's no copay, right?
That is correct.
Yeah.
Also, Carrie, on our Medicare Advantage plans with Blue KC, there is no deductible on any of the ones that we offer. It is strictly copays in certain categories.
Yeah, so what that means to your listening base is there's no first dollar deductible. You can immediately go. Your benefits kick in. You can go see a doctor every day for zero copay.
And that's important to understand. Again, if you want information, the website is bluekc/medicare.com, bluekc/medicare.com. The phone number, 816-395-2916. If you want to talk to Sherry, she'll be happy to chat with you. 816-395-2916. She can walk you through all of this. If you have questions, she'll be happy to help you. Stay tuned. We'll be back from the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. We've got more. Stay tuned. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. You're listening to this, you want to tell somebody about it, or maybe you want to go back and listen to some of it again about Part A, Part B, deductibles, coinsurance. How does all that work? Do we have that in Medicare? Well, go back up on the podcast platform. You can do that on Spotify. You can do it on SoundCloud. TuneIn, Apple Play, all those different podcast platforms. It's up there, and you can listen to the show up there if you need to listen to it again or you want to tell somebody about it. In studio with me, Tony Pointer from Blue Cross and Blue Shield of Kansas City, and Sherry Blankenship. If you want to reach out to them, Sherry is available to you at 816-395-2916, 816-395-2916, or bluekc/medicare.com, bluekc/medicare.com. So let's kind of go back. This is we have these commercials that run ad nauseum during the Medicare period, and they're still running now, even though there is no Medicare period. And you've got Jimmy Walker and Joe Namath telling you that you need to call today because you can get money back. What is that all about, Sherry?
So there's programs out there called the Medicare Part B Give Back. And how that works is if you are paying your Part B premium, then the insurance company will send a certain dollar amount, depending on their program design, back to the government. And then Social Security will add that dollar amount onto your Social Security check. But you have to pay for Medicare Part B in order for that to work.
Okay, so that's important. Here's the thing that drives me nuts about this. They give out this 1-800 number, and then poor unsuspecting people think, oh, my God, I can get money back. Okay, and they call the number, and you're talking to somebody that's in Dallas, Texas, or somebody that's in New York City in a call center. And when you ask them, well, could you tell me what hospitals there are north of the river? And they're going to ask you, well, what river are you talking about? The Hudson River? I mean, what? Because they're not here. They're not local. Yes, they are licensed Medicare agents, but they're not local. So I think it's important for people to understand how that differs with Blue KC. Sherry?
So one of the first things they're going to ask you is your zip code to determine what's in your area. And Blue Cross Blue Shield of Kansas City does have a program out there, and we do put $75 back on that Social Security check.
Yeah, so it's there, but the difference is when you start asking the other questions like, hey, is Liberty Hospital in the network? Is St. Luke's in the network, or whatever the case may be, they're going to – Blue KC, Sherry Blankenship, and the folks over there, they're going to know what you're talking about. That's probably not going to happen with Jimmy Walker's folks. Am I right, Tony?
No, you're 100% correct. Also, too, Medicare just came out with a ruling on that.
Really?
Joe Namath and the rest of the bunch – and I'm a Joe Namath fan, except for the advertisements.
Well, I like his coats.
Yeah.
But anyway, go ahead.
Yeah. Are prohibited from doing that, because what happens, to your point, they're under the impression they're going to get $150, $175 back.
Oh, really?
And depending on where they are, chances are they're really not going to get that dollar amount back. And when you call, typically what we found out is it's really overseas. It's really not somebody here in the United States, let alone
I always wondered why they had
Kansas
those
City.
accents. Now I know. Okay.
Yes.
All right. So they are in Sri Lanka.
It is.
All right. Well,
So,
see,
yeah.
now you know. So, and once again, Blue Cross and Blue Shield has won numerous customer service awards. Their customer service, that's one of the things that distinguishes them from all the other carriers. I don't care who they are, and the same folks that are advertising all this stuff with Mr. Walker and Mr. Namath. Here, you're talking to somebody that lives here, that knows the area, knows the hospitals, knows the networks, and can help you get something that's going to fit what you need, and that's really kind of important.
It is. So we have a lot of different plan designs to accommodate everybody's need. So when we do an evaluation, we'll be able to lead you in the direction to, do you need a plan that does a give back, or would you like a plan that offers maybe another additional protection for you? So it is a give and take on the different plan designs that we do offer. And so when you call us and we do the consultation with you, we can help advise on what it is that you're looking for.
Yeah, and that really, as I always say, a size 44 overcoat doesn't fit everybody, and they're going to be able to help you find the one that fits your needs and what you need. You mentioned, Tony, earlier, Blue Bucks.
Yep.
What is Blue Bucks?
So Blue Benefit Bucks, Sherry probably does a better job.
Blue Benefit Bucks,
Yep.
Okay.
Probably does a better job than I do. But depending on the plan that you choose, you can get anywhere from $500 a year up to $1,000. And it's going to take care of eyewear, dental, hearing, transportation. And you can spend that money where you want, basically. But what it does, it's really money, it's cash. You're going to receive an ATM card, a MasterCard, and you can order directly from the catalog. You can go to Walmart, Walgreens, and you can purchase those daily things that you would need, anything from aspirins to anything health-related, Carrie. It's an innovative benefit, and to be honest, we're really kind of the leader in that field right now for it.
Yeah, that's really pretty cool, Sherry, that they get a little card, a little debit card, and it's got $500 to $1,000 in it, depending on the plan, right?
Yeah.
And that's theirs to use at their discretion.
We want to use it for non-Medicare covered services. But the nice thing about the Blue Benefit Buck is that there are some carriers out there that will limit certain items that you're purchasing, maybe certain lens on your glasses. These Blue Benefit Bucks do not do that. So as long as the vendor will take a MasterCard and they are registered as optical or dental or transportation or audiologist, you can swipe it through their register and it will work. So it is not product specific.
That's really pretty cool. So this is one that used to be a real problem for people. Let's talk a little about it. Insulin benefits on Medicare Advantage. Go ahead, Sherry.
So with the insulin benefit program that we participate in, you can get covered insulins with Blue Cross Blue Shield for $35 a month.
Are you hearing that? All you type 1 diabetics out there? Okay. This is a real problem because what happens is, folks can't get it, and so here's what they do. They put it in the refrigerator and they ration it, okay, and they don't take as much as they should, and then they wind up having an adventure. So this is a big deal. We've got a diabetes epidemic in this country, so let's go back through that one more time. I want people to understand that. That's something that's new, that wasn't around a couple of years ago.
That is correct. So not only is it just $35 a month, you get that coverage protection even in the coverage gap if you were to hit that based upon the drugs that you take throughout the year. So we are not going to adjust the cost of the insulin to 25% of the negotiated cost. It will stay at $35.
That's a really big deal, Tony. I mean, this is a serious thing with a lot of folks.
Yeah. The majority of the calls we get are for diabetic type 1, like you state, and every year we have that issue with insulin. So the insulin costs have been, kind of to your point, I've heard of them sharing insulin. I've heard of them skipping the days, making it truly ineffective.
Yeah.
And the $35 makes it really affordable for almost everybody in the population.
So one of the things we talked a little bit about was networks. So, the Medicare supplement plan, when we were in Hawaii and Lori got treated at the ER before we came home, and we had our surgery here, but all of that was covered because we were on a med sub. There was no network. What Blue Cross has done now on the network side is pretty innovative. If, for instance, I'm on vacation again, okay, and something happens if you have a Medicare Advantage plan, how does that work now with Blue Cross and Blue Shield of Kansas City? Sherry?
The nice thing about our plans is for emergency, urgent care, and ambulance, we are actually going to provide you the protection as in-network worldwide with us. The other nice thing that Blue Cross Blue Shield has done on some of our plan designs is it doesn't matter if you're in-network or out-of-network, you will have the same fixed copay as if you were inside our service area.
Inside the Kansas City Metro, for example. So now if you travel to, let's say,
Florida,
Colorado, or Florida, you're going to have coverage just like you're at home, basically.
That is correct. On our PPO policies, for non-emergency, you will have that protection with Blue Cross Blue Shield of Kansas City. We have a few plan designs that will allow you to carry the same copay even with out-of-network providers as you would with in-network providers.
And that's unique to Blue Cross, isn't it, Tony?
Yes, it is. And also, too, if you're traveling and you have the sniffles, maybe a sinus headache, all of our plans, too, have telehealth. So you can be in the car, you can call the 800 number, say, hey, we're pulling into Birmingham. They can call your prescription, and they can take care of it that way.
Yeah, and that's really cool. And telehealth, which people used to not use at all, but since COVID, it's become extremely popular, and a lot of folks use it now, and it works really well. And I will tell you, Lori and I have used it, and it's a lot easier than having to go sit in a waiting room, park, and go through all of that. So the telehealth thing really works. If you want more information from Blue Cross and Blue Shield of Kansas City, the website is BlueKC/Medicare.com. BlueKC/Medicare.com. If you want to go up on the website, all the plan designs are up there. All the information is up there. Or if you just want somebody to walk you through it, Sherry will be happy to do that. You can do it at 816-395-2916. 816-395-2916, and she'll be happy to chat with you, just give you some advice and information. They're happy to do it. When we come back from the break, we'll wrap it up. You're listening to America's Healthcare Advocate, broadcasting on the HI Radio Network, coast to coast across the USA. We'll be right back with more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across a fruited plain here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. These shows are on the podcast platform. A lot of information out here today, kind of like drinking from a fire hose, right? Trying to listen to all this stuff and figure it out. Go up on a podcast platform. You can listen to it over again. All the information, the shows are put up there complete, so you can go up there and listen to it. Like I said, Spotify, TuneIn, iTunes, SoundCloud, Apple Play. They're up there on all those platforms. You're more than welcome to go up and look. In studio with me, Tony Pointer and Sherry Blankenship from Blue Cross and Blue Shield of Kansas City. The website for Blue KC, if you want help with Medicare, BlueKC/Medicare.com, BlueKC/Medicare.com. If you just want to talk to somebody and get some help, 816-395-2916. That is Sherry's direct number, 816-395-2916. She's happy to help you. So give her a call, and she'll be happy to chat with you. All right, so let's kind of go back for a second here and catch one that there are a lot of veterans out there that up until now have not been able to do a Medicare Advantage plan because the way it works at the VA with the Part D and all the rest of it, it was a nightmare. Not that the VA ever makes things a nightmare. I'm a vet and I'm on the VA, so trust me when I say I know. So talk about how now you've got a plan that blends in with the VA coverage and works. Sherry?
So absolutely. If you have Medicare Part A and B, you can purchase a Medicare Advantage plan, and that really gives you a second opinion option. So you can either go to the VA and use your VA benefits, or you could utilize the Blue Cross Blue Shield networks and our plan designs that we offer. And we have some plans that have prescriptions that are included, and then we have some that do not have the prescription drug policy where you would still obtain your prescriptions through either TRICARE or the VA. And you could still use Blue Cross Blue Shield doctors if you prefer to.
Yeah, and that's pretty cool. Okay, so just so recap a little bit what she just said there. You remember what Tony said and what Sherry said. 0 premium plans. So you're on the VA thing. Maybe you don't want to, have to go through the wait and the process and all the nonsense you go through at the VA, and you want an option for a little better care. This is a lot better care because you've got the Blue Cross and Blue Shield network here for all of the Medicare Advantage plans. But the stumbling block has always been the prescription drug benefit, Tony, and That's not the case now.
No. So Sherry brings up a great point. It's a 0 premium plan. So if you're part of the VA, that card costs you nothing. You can keep it in your wallet. You don't have to do anything with it throughout the year. However, God forbid you were to go to the VA and they said you had cancer. I know I want that second opinion. And with Blue Cross, you have that option. Also, too, with VA, they do have prescription drugs. You can get the prescription drugs portion with us as well. Or you can choose an MA-only plan with no prescription drugs. Just depends on your individual needs.
So this is another kind of quandary some people have. They're working past 65. A lot of people are working past 65 these days. They're on the employer-sponsored health care, but they go, I could go on the Medicare plan. The one issue that I've always seen with that, where that helps make a determination whether they're going to do it or not, is prescription drugs. Tony, talk a little bit about that. If somebody's got a lot of heavy-duty drugs, how does that work?
Yeah, so that's a great point. We are seeing people retire later in life, 67, 68. They are bypassing 65 anymore. So they definitely need to take an individual look at their prescription drugs. They need to call someone like Sherry and sit down and see exactly where they are. Typically, the formulary on a group plan is larger than it would be on the Medicare plan, and also, too, the copays would be less.
So, Sherry, that they can explain formulary so folks out there know what we're talking about.
So formularies are a list of prescriptions that each insurance company is willing to cover. And a lot of times with the group health insurance plans, there's some protections out there in where they do not have to experience a coverage gap as you would have to underneath a Part D prescription drug plan with some drugs. And so depending on your drug list and what you're going to end up spending, it may financially be in your benefit to stay on the employer plan. However, for those that are out there that do not take a lot of prescriptions, you could find a lot of savings switching over to the Medicare Advantage policy.
Yeah, but that's exactly why it makes sense to call and talk to you, okay? Or if you've got an independent broker out there, that you've worked with, you can talk to the broker about it. But make sure that you take that list of prescription drugs before you make that decision. And then go in and sit down and talk. And here's something, human resource directors are not good at this. It's not their job, is it, Tony?
No, it's not. And what we found out is 99% know nothing about Medicare.
That's right. And, that's why, brokers and agents get to spend a lovely 21 hours a year being recertified for Medicare, and you have to get a 90 on the test. I don't know any place else you have to get a 90 on the test to pass, and you get 3 tries, and if you don't get on 3 tries, you're done. So I'm telling you all that for a reason, people, that these people really do know what they're talking about, okay? And it's important to understand that so that when you do have an issue like, do I get off the group plan? Do I stay on the group plan? You just heard Sherry say, get the formulary, pick up the phone, give her a call. She'll tell you what's covered and what's not, okay? And maybe you're better off on the plan or maybe they're not, but they won't know that till they have a consultation with somebody, right, Sherry?
That's correct. And so once I get a list of their prescriptions and dosage, I'll actually do a cost analysis for them to let them know exactly what it is that they're going to spend based upon the prescription list that they gave me.
Okay, that's pretty significant. You're going to give them the cost analysis. They can then look at it in black and white and go, this is a good idea. I'm going to have 0 premium plan. My prescriptions are covered. It's good to go. Or I'm going to have zero premium pen, but I'm going to get stuck with a bunch of prescriptions that aren't covered, and I'm going to have to pay for them, and maybe that's more money, right, Tony?
Yep, exactly right. So Sherry does a fantastic job sitting down with them and analyzing their needs. And also, too, Sherry's a resource. Just because you speak with her doesn't mean you have to sign up.
No, and people need to understand that, and I've said that before on these shows. You're welcome to call them and talk with them. This is not high-pressure sales or anything like that. They're more than willing to walk you through, consult with you, and help you, and let you go back and, think about it. You got to talk to my husband. I got to talk to my wife before I make a decision. That's not unusual, is it, Sherry?
No, not at all. And a lot of these members are actually underneath the Blue Cross Blue Shield group health
Already.
Insurance plan. So it's not our intention to pull from one product to another.
Yeah.
We want to do what's in their best interest.
Thank you both for being here today. I thought that was a pretty good show, a lot of information. And now, ladies and gentlemen, I'll leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken. Thank you for listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Goodbye, America.